Good morning, everyone. What a thrill to see you all here. What a thrill to see 2,400 of us here at the meeting live. I think many of you have put up with me saying different things over the last 20 years, but back in the day there was about 20 of us at the first meeting, maybe less than 100 at some of the others, and what a blessing, what a platform we've been given. I have the opportunity to share with you just a few opening remarks about Full Plate Living and about our intent. And Amy, if you want to advance that slide. Full Plate Living is a small piece of what we do at the Ardmore Institute of Health. And really the goal of Ardmore, as captured here, is working for a future where healthy lifestyles are equitably and preferably the way to take care of each other. And one of the things that we have really come to realize over time is that equitable piece is very important. If you think about our history, Ardmore Institute of Health has been around in one form or fashion since about 1945-ish. Our board, as it's constituted today, started off in about 1985. We initially built a hospital or two, and we staffed it with a whole health approach. And that was wonderful learnings. We passed that off to a larger organization that ran it, and it still exists. You know how the mergers happen in Ardmore, Oklahoma. We then, in the early 90s,
I can even show it if you like.
developed, I don't want to steal your slides.
I'll forward it.
We developed an in-residence program, and that in-residence program went on for 20 years. And our focus was using lifestyle. It was called the Lifestyle Center of America, as many of you remember or know. The focus was on bringing people in and transforming their lives. And we were so successful that some of you might remember the book that Franklin House authored, along with several others, called The 30-Day Diabetes Miracle. Many people chuckled at the title, but it really was quite miraculous to bring someone in and 11 or 14 days later have their life transformed. It was also quite miraculous to see their bank accounts go down by $8,000, and they weren't even paying half of what it cost us to bring them. We did that for 20 years, and we learned a lot. And we also learned, when we stepped back, that simply bringing people to a place and changing their lives wasn't enough. It was necessary, it wasn't sufficient. And so what we did is ask ourselves, what needed to be true to sustain the efficacy of the approach? We did the Full Plate Diet book in 2010, New York Times bestseller. And then we embarked on a journey of trying to do less ourselves and doing more with y'all. And over the last 10, 11 years, we've had the privilege of sharing about $20 million in grants as you've developed programs, as we've developed programs. And where we're at today is just what you're going to hear a little bit more about on the Full Plate Living program, a platform that has a direct-to-consumer approach, that has tens of thousands of people engaged, a way of having facilitators actually take this product, lay facilitators, and lead groups to improve their self-care and well-being. And then we're just delighted to be, as you know, a recognized lifestyle program by ACLM, and then to have our partners at the American Academy of Family Physicians not only help us build that, and I don't know if John's here, John Bonnet, but Don Bonnet and others have worked with AAFP. And we're tickled now that we can not only offer the shared medical appointment program as a tool in your office, but you can learn about it and get CME credit. So Amy has been the face and the body of and the mind of Full Plate Living for about 20 years. And she tells me what to do, so she's told me to get off the stage. Thanks for being here. We're happy to talk to you in the future. Thanks, Amy.
Dr. On sound, everyone. It is a privilege to be here today, especially with this gentleman here. I am very honored to get to do this work, and I know many of you feel the same way that you get to do this. So today, here's our panel of speakers. Janet Calhoun, she's our SVP and COO. She is not able to join us today. So I am Amy Hannes. I am the program director here at the Ardmore Institute of Health. And then I'll also have Kaylee Anderson. She's with Plant-Based Mavens. We work with her very closely in a lot of our products, and really thrilled to have her speak today on the nutrition piece. So let me figure out where I'm at in our slides. Goals for this session, we have these up, so I won't waste any more minutes with that, but we have some great stuff that we're going to share with you today. Yes. Volume is very low. Can we up it? I can talk louder too. Okay, I can project for sure. Ron told you a little bit about the Lifestyle Center of America, our New York Times bestseller, and of course, after doing programming in a residential facility, people knew that we knew programming pretty well. So a lot of things have developed and come from really that expertise that we have from those time frames, and a couple of us, even with AIH, worked during those times as well. And so when we look back after doing such an intense lifestyle program, and we came out with the Full Plate Diet book, and then later it evolved in Full Plate Living programming. These are things that we constantly hear from not just ourselves and things we want to accomplish, but also our members, that we are very doable. It's not overwhelming. Our whole focus is on whole unprocessed fiber foods. We're going to talk a little bit more about the nutrition of that piece. A very positive approach, no shaming. Every positive step is worth celebrating. We don't just tell, we show. And it's not a diet, it's a way of living. It's how we want to change our habits. So we do have 3 programs. I'm going to go to this in more detail after Kaylee talks. So we have our online platform like Dr. Stout talked about. We have our shared medical appointment programming, and we have a facilitated group programming that's lay written for anyone to lead. And then how many of you are familiar with Full Plate Living before this? Oh man, we love y'all. Thank you for being here. How many are actually hosting a group program? How many are doing the new SMA that's been out now a year? It came out a year ago, so several people. Notice those people. If you're doing SMAs, you want to hit them up later. But we do have actually some updated programming and some new things. So I will be going through our updates on our facilitated group program, as well as updates in the shared medical appointment. And then we have a new facilitator training available, and a new CME that Dr. Stout was letting you know about earlier too. So I'll go through a little bit on the details of that. But right now, I would like to turn this over to Kaylee Anderson to talk about Full Plate Living and the nutrition stance on this. So welcome, Kaylee.
So it is not news to anyone in this room, I'm sure, that we are in a chronic disease crisis in our country. And when we look at the leading causes of death, at least 7 out of 10 of these are potentially diet and lifestyle related. And with the majority of adult Americans having at least one chronic disease, it has never been more important to find sustainable solutions, which is why probably a lot of you are at a conference like this. There we go. And when we look at modifiable risk factors for chronic disease, poor diet is at the top of the list, along with sedentary lifestyle and tobacco use. And it's estimated that if we can address these 3 modifiable risk factors, we could potentially prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancers. So when we talk about poor diet, what are we talking about? Well, the Dietary Guidelines for Americans report shows us that Americans are exceeding intake for added sugars, saturated fats, sodium, and the top sources of those are ultra-processed foods, salty and sweet snacks, burgers, pizza, red and processed meats. And that same report shows us that Americans are not getting enough of a long list of important nutrients that we see here. And the ones that are bolded are considered nutrients of public health concern because the low intake is so dire. And you'll notice fiber is one of those bolded nutrients that we're not getting enough of. And these nutrients, of course, are found in foods like fruits and vegetables, legumes and beans, whole grains, nuts and seeds, right? And when we look at fiber, over 90% of women and over 97% of men don't meet the minimum recommended intake of fiber. And I've seen that stat so many times, but it still feels so shocking to me that that many people aren't getting to that minimum amount. And the benefits of a high fiber diet are very well documented. It can increase satisfaction and lower overall calorie consumption, help reduce constipation and regulate bowel movements, reduce blood pressure, help normalize triglyceride levels, lower cholesterol, promote normal blood glucose levels, maintain a healthy weight, help to reduce potential cancers, and even improve things like depression and anxiety. So fiber is so important, yet this many people are not meeting the minimum recommended intake. And of course, over 85% of adults are under consuming those high fiber foods that we talked about, those fruits, those vegetables, those whole grains. And that's really why we focus on fiber at Full Plate Living. And the heart of the Full Plate Living approach is this 75-25 plate that we see here. And so we help members to work towards filling 75% of their plate with those high fiber foods that have all of those health benefits. And even though that people aren't meeting that minimum recommendation, there are health benefits far beyond that minimum. So we don't encourage people to count every single gram of fiber that they eat every day, but we do help them work towards at least 40 grams of fiber, so well above that minimum recommendation, because there are more health benefits that they can get beyond that minimum amount. So again, that 75% is filled with those fruits, vegetables, beans, and cooked whole grains. And of course, we did not make that up. Those recommendations are aligned with the leading nutrition recommendations across the world. So this is a cool study that looked at 78 guidelines published by major governments, medical societies, health stakeholder groups. And I love this study because the world has us believe that nutrition is really contentious and confusing and that we don't know what we should be eating. Yet there is large consensus on what we should be eating when we look at studies like this. So what they found was that these 78 guidelines had the common thread of the recommendation to increase consumption of these high fiber foods, the fruits, vegetables, whole grains, beans, and legumes, which is why we focus on those things. And so these guidelines, of course, are the what, right? And a lot of people might know the what, but Full Plate Living is the how. How do we do this? How do we make this sustainable for everyday people? So what about that 25% of the plate? Well, we tell members that they can fill that 25% with a reasonable serving of anything. And that bakes in the important flexibility, the autonomy, the freedom of choice, and the small change approach that is so important in sustainable behavior change. And while they can fill it with truly anything they want, we also, in our programs, teach members how to fill it with healthier options if they're looking for greater health benefits or health changes. And one of the ways that we teach the difference between 75% foods and 25% foods is with the concept water fiber foods. So as we've said many times, we emphasize those whole unprocessed fiber foods. They're rich in fiber, but also they are rich in water, which brings in that satiety piece, which helps to make this way of eating really sustainable when people feel satisfied and satiated for longer periods of time. And so this is a beach analogy that we use to kind of teach this concept. And you'll see on the water side of things, those whole unprocessed fiber-rich and water-rich foods, so things like cooked whole grains. We see cooked brown rice, cooked oatmeal, our cooked beans, our whole fruits and vegetables. And then on the sand side, we see foods that are high in fiber, of course, whole grain breads, whole grain tortillas, crackers, nuts and seeds, but they're missing that high water content. So these foods would actually be considered 25% food. So you can see how someone could really make a very healthful plate if they're filling their 75% portion with those foods in the water, and then choosing some of those sand side foods for that 25%. We also have designed our programs with behavior change science in mind. And so we take a successful small steps approach with our members. BJ Fogg, a behavior scientist at Stanford University, has helped to popularize that research that underpins that approach. He wrote the popular book, Tiny Habits. His research also informs another popular manual on behavior change, Atomic Habits by James Clear. And BJ Fogg said, in order to design successful habits and change your behaviors, you should do 3 things. Stop judging yourself, take your aspirations and break them down into tiny behaviors, embrace mistakes as discoveries, and use them to move forward. And I chose that quote because I think it really speaks to what Full Plate Living does. So we give members an approach that is very non-judgmental, supportive, compassionate. Health behavior changes are broken into small, doable steps. And we encourage a sense of curiosity and frame any mistakes or missteps as normal parts of the process and really excellent learning opportunities to help them move forward. And a couple years ago, we surveyed our members about our programs, and we asked them to tell us what they love about Full Plate Living. And these are the phrases that rose to the surface over and over again. They love that it's doable, that it's simple, sustainable, that it's flexible and approachable. They love that there's no forbidden foods, and they feel like they are allowed to make their own choices about what's on their plate. And they love that small steps approach. So let's look at this in action. This is what we call a meal makeover, and we have lots of examples of these in our programs to help members really put this into context. So say you have someone that would enjoy eating a meal like this, some pizza and breadsticks. Well, they can work towards that 75-25 plate by replacing a slice of that pizza and a couple of those breadsticks with a really hearty side salad. So we're not quite at 75-25 here, but we are getting close, and this could be a really good change for some people. And if they want to take that a little bit further, they could swap out another slice of pizza and that last breadstick for a really fiber-rich bowl of soup and a big bowl of fresh fruit. Now we're looking a little bit closer to 75-25. And the beautiful thing about this is that that person can still enjoy the pizza that they like to eat, but they've made some really meaningful changes to the nutrition profile of that meal. So they don't have to give up their favorite foods if they don't want to, and they can still make some really powerful changes. And the beautiful thing about Full Plate Living is it's a blueprint that people can take anywhere and everywhere. So it's not something that only works in a vacuum of perfect circumstances. They can do this at home, buffets, potlucks, restaurants, lunchtime at work, wherever they are. And these are just a few examples of photos that our team has taken in different settings of that 75-25 plate. And nutrition, of course, is the center of what we teach at Full Plate Living, but we are all lifestyle medicine people, and we understand that there are so many other factors that shape someone's health beyond just the nutrition piece. And so we've included lots of other topics in our programs that we help members with, everything from navigating family and social situations, building a support system, developing skills for meal prep and dining out, and navigating emotional eating, and then all of the other pillars of lifestyle medicine are also included in our programs. We also have a vast library of expert-led workshops, and you will recognize the faces of the folks teaching these workshops as leaders in the lifestyle medicine space. And the workshops range from topics on heart disease and blood sugar to how to build purpose into your life, to navigating menopause, and these are all freely available to our members to watch. And the Full Plate Living program itself is evidence-based, so it has been tested in the literature. And if you scan this QR code, it will take you to our bibliography, where you can see all of the research that we use to inform our program, as well as publications that have actually used the Full Plate Living program in their interventions. So I'll give you a moment if you want to grab the QR code for that. And one of those publications that I'll share with you quickly here is this one that looked at 4,000 adults in an employee health setting that went through our program over a 16-week period and saw some really meaningful results. So there were significant improvements in all measures of health factors. For the folks who lost weight, they lost an average of 7.2 pounds over those 16 weeks. The most notable improvements were among increasing intake of those high fiber foods, fruits, vegetables, and beans. Energy levels was also the most noted self-reported improved health factor. And there was also improved confidence in their ability to lose weight and to make healthy choices in that period of time. So that is also included in our bibliography if you want to look at that a little bit closer. And having an evidence-based program is really important to us, but the most important thing is having a program that actually facilitates meaningful change in people's lives. And so now we want to share some of our member success stories with you, and you might want to grab a tissue because these always make me tear up a little bit.
By now you might be thinking, this program sounds too good to be true. Does it actually work? Let's hear from a few of our longtime Full Plate members who are living proof of how well this program works.
Well, I'm over 50, and every time I talk to people about my age, they can't believe it, and I think it's part of the way I eat. They ask, well, what do you recommend or what do you do? And I say, Full Plate. It's so easy.
Since I'm a heart patient, one of the things that my doctors look at is cholesterol, and my A1C, I was actually considered pre-diabetic. When I started Full Plate and really bulking up on more fiber, the last readings on my A1C, I was down at like 5.1. That's normal. That's considered good.
At that time, the doctor said, it would be very nice if I lose 10 pounds, and I laughed at him like, haha, I know that it would be nice, but that's not happening. And now I weigh kind of between 145 and 148.
My A1C, as I told you, it was 8.4 last August or so. Now, last week I had my A1C done, it was 6. So it's a huge improvement.
I was lazier than anybody, and I walk more now than older people. And I always say, if I can do it, anybody can do it. And my doctor, she tells her patients about my story.
Now I'll pass it back to Amy to tell you a little bit more about the nuts and bolts of our programs that we have available.
If you sign up at FullPlateLiving.org and go through our online course, it does bring tears to my eyes because I remember the day we filmed those, and they're very special, special people. And what is great is you're doing that where you're at. So thank you for the work that you do. Oh, gotta get past that. Oh, very blessed. All right, so our Full Plate Living products, I showed you these 3 earlier, so I just want to go through each of these a little bit in detail. FullPlateLiving.org/share. Even at FullPlateLiving.org, at the very top, there's a sharing Full Plate Living. If you go to that, that's going to be resources for you to share Full Plate Living that you have access at your fingertips. But let's go through some of those. I'm going to start with the shared medical appointments. So these, we actually last year came out with our first one. I don't know if any of you went to the shared medical appointment session that Dr. Jacob Mirsky did. He's pretty, he's like the SMA guru. And so we got with him and we said, Jacob, what would it need to be true to put this material in an SMA format? And so he created our 8 session last year, which we released at ACLM. And then since then, we did an update with a 4 session and a 1 session. So if you're just wanting to dip your toe into an SMA world, that 1 session one is for you to check out. But we do provide the provider information and guides, notes, templates, and then patient support materials. So every single session that is created has a patient handout that's digitally available that you can do virtually or in person. And this is kind of an example of the session here, kind of the slide deck format, and then of course there are the presenter notes down there for you as well. And this is a sample of the patient handout that we give. So like for this one, we talk about behavior change. Why? You know, what is your why? Why are you wanting to make these changes? Those make such lasting, deeper results. So just kind of an example of that. I want to go back to the share page. So when you go to the share page and you click on the SMA, the shared medical appointment icon, the only thing we require is your name and your email address, okay? And then you'll create a Full Plate Living account, and then you'll have access to the Drive folder with all of those slides and presentations available immediately. We just ask that you download those so that you can make those your own. Our master files are our master files, so you won't be able to edit those, so you will need to download those to have a copy for yourself. And if you're not familiar with shared medical appointments, we did create, with AAFP, we have a 2 free CME that you can take. You can also learn more about that on our website, Implementing Shared Medical Appointments Utilizing Full Plate Living. And so it just goes through the best practices for implementing, resources available, and then you'll kind of do a deep dive into our curriculum to have access to that too. So a little bit about the 2 credits below. So of course, absolutely, we understand doing SMAs, doing things in clinic is phenomenal, but it's not doable for everyone. So we also have the online program. This is our self-guided membership. We usually use membership with our members. It's free to sign up. So FullPlateLiving.org, they can sign up for free, and they immediately get access to our core program. This is our core healthy eating program that teaches the Full Plate Living philosophy. After they complete that, it's 7 modules. After they complete that, they get access to bonus courses on weight loss and diabetes, and those are each 4 modules each. They also gain access to all the previous recorded workshops, like Kaylee mentioned, with, experts, and then we do monthly workshops still. So like in November, we'll have Karen Smith, she's a diabetic educator, RD. She'll come on and do a live workshop with our members, and then we'll also have that recording available that we put out. We also put those on YouTube, so if you're looking for materials and certain topics, you can also access those to share. We have a weekly email that we send out. The #1 request people get is recipes from us. Imagine that. So we share recipes every week. We share 5 different ones, along with recipes are great, but how do you create a meal with that? Right? Not every recipe is a meal. So we say, well, here's our idea of what a full plate meal could be for you with that recipe. So just kind of framing other things that they could do, giving them ideas. And we have an online community that they can join in that's just for our members. We want to provide that support and we want to cheer them along. We definitely And it's in Facebook currently right now. We're looking at other things that we can do in the future. But what's really cool is having members support members and just really cheering along. Even the one step of, well, I did not do great today, but I did eat an apple. Yes, you ate an apple. That is awesome. And this is just kind of an example of the orientation session. I think this is what this is, or maybe this may be module 1. But it's a mixture of different videos, kind of like you saw our success stories, as well as different reading pages. We also build in exercises for them to do, kind of worksheet exercises, if you want to call them that, of, what is your purpose? Why are you wanting to do this? If you were the person that you want to be, what would be so great about that? Just helping them vision that, helping them go through different exercises to have those aha moments. And then that share page that I was telling you about on our website, if you click on the avocado piece for the online program, the resources there for you. We have a one-page handout, which I know in the registration, I had many people say I need a one-page handout. That is there for you to digitally download and print if you would like, put in your EMR, however you would like to use it. We also have tabletop displays. We have these at our booth here, so please come see us. We also have these posters. The one on the far right is a poster, so we have some of those available here as well. And we have QR codes, after visit summaries, things like that. These got developed from people like you asking for them. So if there is something that you feel that would help you in sharing Full Plate, please ask us. Probably the worst thing we can say is not right now, but we can definitely add it to our list because we do honestly want to help you with the work we're all doing. All right, so our facilitator material. So this is our group program that is led. Anyone can lead it. It does not have to be an expert, but I'll say that and automatically say we have clinicians that do this in clinic. So it has been used in such a diverse setting, which I absolutely love that people have taken and made it work for them. It's used in employer setting. You saw some data earlier. It's used in the employer settings. It's used in universities. It's used in communities, churches. So it is literally a written script. Anyone can lead it. It's 8 sessions. We recommend weekly because you want to, we're a small step approach. So, okay, tomorrow, what is one fiber food you could add to your meal? You want them to try those things, those small steps, and then come back and kind of report on how did it go? How did it feel? Was it a struggle? Did you just nail it? How did that go? So we do recommend a few days between. Our recommendation is ideally a week, but we understand you have to make it work for you. Let's see. We also have this in booklet form, and we do have a sample of that at our booth if you do want to see it. So go to the share page, you click on the facilitator materials. You can actually download the 2 guides and print them and use them yourself. We updated that. I think we had that update 2 years ago. We did a newer version of that. This year, I am really excited about, we created this whole program in a slide deck format. It does not require the guides if you do not want to use the guides. And we mainly did that just so it's accessible to more participants. If they cannot afford a guide or you cannot afford a guide for them, then you can literally just do like we are doing today and do the entire program from a slide deck virtually or in person. And we do have a toolkit. We do have kind of a free info session that is literally a written script as well, that kind of is a time that people could come learn a little bit about the philosophy, learn a little bit about the program that you're looking to lead, and then register at that time. That's also in a slide deck format this year. And one of the things we had many clinicians ask us, because they said, my staff doesn't understand this. How can I onboard them? So this year we finally finished creating our facilitator training certification. They can go through a 7-module, I'm getting a little confused if it's 7 or 8, it's 7 modules, 7-module course to be Full Plate Living certified. That is also available. It goes through a lot of the nutrition. You'll see Kaylee that presents in. What I do love about that is that it is expert-led as well. kind of like you see our workshops. We have lots of experts that we work with. It is too a mixture of videos and reading, worksheet exercises, and this one they do have to pass the quizzes, so 100% pass rate for this. But here are some of the different presentations that are within the course. You'll see the art of facilitation. John Goebel, he's fantastic in the behavior change, nutrition area. Kaylee, as I said, does our nutrition. Karen Smith, our diabetic educator, and all of these are just amazing people that we work with. Jessica Matthews, John Bonnet, and Jacob Mirsky for our SMA. So before I open up this time for questions, I just wanted to you saw kind of our success stories. We have a lot of people that share their feedback with us, but I loved some of these, like I had a fiber epiphany. Wouldn't you love for every patient to say that? I had a fiber epiphany. That we are no hype, and honestly, we do not upsell anything. Everything on our site is 100% free, available to you and your patients at no cost. It is an honor to work for AIH and provide this as a free service to you and your patients. But we love our members, and we are very honored to work with a lot of you, and thank you for your time today. So. Thank you, thank you. If you want to access the share page right now, you can go to the QR code. You also have in every single one of your ACLM bags, there is a flyer with that information too. So you can pull that out. On the back side of the flyer is that one-page handout I was telling you about that many people asked me for. You can make copies of that. You can also access it digitally here. I'm going to ask Kaylee to come up just in case any questions. And let's see. Michelle, Abby, or Paul, I need 2 people. Because I'm sure we're going to have questions. Okay. Oh, perfect. Okay, excellent. Or at least one of you. Just one. The other 2 can stay. See if it's on. Hello, hello.
Hello. Yes.
One of the ones I'm going to go ahead and answer right now is we had several people ask us about Spanish, and we do have a few different items. We have a few older items, so we don't have any of the updated items that we've done really in the last 2 years in Spanish yet, but as you can see on the right-hand side, it is on our goals list for this year. But you do have access right now to the Full Plate Diet book, was translated into Spanish, and we do have an older version of the lay group program that is also available that you can download and print and use as you would like. We have met a gentleman that has already translated the SMA into Spanish, so we hope to connect with him. And we know a few others that are doing, actually they are working, they're translating and doing SMAs right now, and so they've been working at that. So we want to kind of figure out who else is kind of working in that space and how we can really get that to you soon. So we do have that on there. So if you want to access this on the FullPlateLiving website, you can scroll all the way down to the bottom and you'll see that link available. Dr. Stout, do you have a question? Or just, I have a list of things I saw people when they registered that they asked for. So we have a couple. Okay, go ahead.
Hi, I'm Jo Brown Spades. Thank you so much for the presentation. I was curious about the use of SMAs with the online program. So do you have people that go through the shared medical visit kind of protocol and then at the same time include them in the online program, or do you prefer to do that separate, or how does that work?
Wonderful question. We love that you can recommend Full Plate. We would recommend doing it afterwards, and we even built that into the slide deck that said, but wait, hold off. We know you're probably going to want to join, and they could. They're just going to immediately start getting pushed emails and things for us because we want them to then start the program, to do the program. But if you're still kind of teaching some of those things, and we built it in the slide deck, you say, I know you really, really, really probably want to join this, but you need to wait. And then at the end of the slide deck of the SMAs, we do encourage you to encourage them to sign up, because that's just going to continue their support with that philosophy long term. Yeah, you're welcome. Good question. Paul.
Hi, my name is Cristina Añez. I work at Northwestern Medicine in Illinois, and I've been, since last year, I met you guys. First, I want to congratulate you for this wonderful program. I did it myself, and I share with 100% of my patients. They all scan the QR code, but only 1% had followed all the course. They stay on module 1, and what I'm trying to do is like every visit, can you do another module? Can you do another module? And now, since I cannot control my patients, but I can control myself, what I'm trying is every visit, share something from the Full Plate Living, like Fiber First, for example, which has been a hit, by the way. But I have a question here, or maybe a suggestion that I was thinking. The food makeover pictures are out like amazing to show them like in a real world, how would your full plate look like if you add more fiber? Because when you say fiber to patients, they'll think on the other side, like the bread and the tortilla and all of that. But if they see a picture in like that we can show just for our office, just like a couple of a makeover, that definitely will do a change on them. So that was it. Do you have anything like that? Not really, right?
I don't currently have anything like that. I mean, you could always take like our slide deck or something like that if you wanted to print out, because we do a lot of the meal makeovers like Kaylee showed you. But I literally just wrote down patient handouts. So this is kind of what I was saying, recommendations. We always want that. So I will absolutely put that on our list, because we do have things we could put together. It's just a matter of the time frame to put it together. So
Thank you so much.
thank you. I appreciate that. And thank you for sharing Full Plate with your patients. I have a few other items here on the list if there are no current questions. Someone asked about specific health conditions, and while we kind of what we do is more healthy eating, healthy lifestyle, we do have, you know, the bonus courses on weight loss and diabetes. But if you had a patient that didn't need to eat like high potassium foods or certain things for certain diseases, we don't provide that type of information. I know there's some other services that really provide that. If our members ask us those sort of questions, we do always recommend, number one, they should ask their physician. And then number two, that we'll usually send them to a credible resource. We do not do that ourselves. And many people here say they came here because they wanted to eat healthier. So one, I would recommend for you to sign up at FullPlateLiving.org, go through it yourself, experience it, know kind of the philosophy of what we do. The other thing people ask is that they want to feel more confidence and sharing this information with their patients and their clients. And I think one, sometimes it's just two, going through the certification is probably the number one step I would say do to. And then the second one is set the date for for the first program that you're going to do, and do it. Because experience, there's nothing like it. So do it. It might be nerve-wracking, but I'm telling you, you're going to be such a blessing to who you're working with, that you'll immediately just feel like, yes, this is what I meant to do. And Kaylee's just shaking her head, because it can be a little bit intimidating, but it is definitely, if you have a desire to do it, set that date.
Much easier when all the resources are done for you, even scripted for you.
Yeah. I had someone ask about meal planning, and we don't particularly do meal plans. I think there are a lot of services out there that do meal plans pretty well. We really work with people of where they're at, what the foods and the plates that they're making, because some people, and many people have changed their entire plate, and a lot of times it's hard to pull or drag along their families and people that they live with. So we don't necessarily usually do meal plans. We want people to do that small habit adoption of just changing and adding fiber foods to the meals they're already eating. And so while we see the value of meal plans in different situations, our focus really has been about adding to their current plate of what they're eating.
Amy, a couple things if you could touch on. Please share a little bit about how we've added portions of Diet ID last year. And then please give an advance announcement that folks that are members of Full Plate Living will have access at our expense next year to the LIFT project. But tell us a little bit more about that.
Yes, so We wanted to provide a survey service. So we did partner and we contract with Diet ID. So everyone that goes through our online program currently is pushed to take a survey. It's not required. They have the ability to. We ask them to as kind of a thank you for providing a free service. And so we are really excited to do that. We ask them to do that periodically because we do want longer term data on the program. It is available for group program people too. We just have not built that in yet, but it is available. And we hope to have some really cool data coming from that soon. The LIVE project, we had Dr. Darren Morton on, I guess we're still in October this month. I live in the future so much. This month, and he did a workshop for us. We are really thrilled to partner with him and offer that piece to each of our members. So we will be, at our expense, as Dr. Stout said, we'll be paying for that as an additional add-on to our current product listing for people who want to do that.
Well, I've got you another thing to talk about. One of the things we get challenged on from time to time is free.
Yes.
Because there is a portion that you can spend money on if you choose. All of our products are available for you to download digitally, for you to print off free. Some of y'all don't like to do that. Some of your patients don't like to do that. So we've partnered with Amazon, and some of our products, all of which are available at no cost or free directly from us. But if you want a hard copy shipped to you, say a little bit more about Amazon.
Yes. Well, I mean, a silver lining of COVID was really putting everything into the digital format. We had many people who were doing groups and said, I need this digitally. And so we created it that way. But of course, we all work remotely. So it was, how can we make it even more accessible to you? So we do upload our products to Amazon that you can just order however many you want. And it's actually less expensive that way. So the workbook, we do have a workbook of all of the exercises on the online membership that are collected together because a lot of people did not want to print off different pages. And so we did collect those. That's probably the most expensive book on Amazon. And it fluctuates a little bit in price. I want to say the last time I saw it was about $40, $38. Is that right, Paul? Do you remember? $29? Oh, excellent. That got even better. And then the participant and facilitator guides are also available on Amazon. They run between $25 and $30. Well, thank you again so much for joining us. If you have questions that pop up later, we will be at our booth. Come by and see us. We're happy to always talk things on Full Plate Living. Take care.